the panelists to come up and take a seat. I'm going to come down the aisle and see if there are some questions that people don't want to ask themselves. So we'll take it in writing, and I will share those questions. In the meantime, I know that Dennis had a question that he was dying to ask the panel, so I'm going to give him the first opportunity while the panel gets set here.
I really love the marketing thing. I started a marketing company because I was so frustrated dealing with people trying to sell my things who didn't understand what we were trying to do. But I had a comment. I actually think we made an error in believing that there are different buyers and purchasers and nudgers. So the pharmaceutical industry knows this quite well. The patient is not paying for the pharmaceuticals, but what you see on TV is what I call the Happy Meal kernel. Ask your doctor about. I learned this from McDonald's, which is ask mommy to go, or daddy to take you to McDonald's for a Happy Meal. We actually tested that for parenting, for a whole nationwide safety intervention, and we found that using the child to market to the parent to adopt the parenting practice and to get the school involved, teach the kid to ask for it. So one of the things we need to separate is understand that there are multiple players in the adoption and implementation and use of these prevention strategies. It remains a completely untapped market to provide behaviorally based prevention strategies as a for-profit purchase. There is no evidence-based practice, I believe, on the National Registry of of evidence-based programs and practices that you can purchase on Amazon. And there should be. Why don't, this is a whole different array, and it would fit your model perfectly.
Great. Do you have any reactions to one another's presentations? I wanted to give you guys the first opportunity to actually serve as a panel of discussants.
Well, I thought I'd mention something that we've been working on at Indiana. We've actually set up a Center for Implementation and Innovation Sciences, and that is actually a sort of a citywide almost partnership between the university and some of our local clinical stakeholders, our local hospitals. And this is an organized program to actually bring our research findings into practice in those institutions. It's received investments from our local hospital systems, which have now set up units within them called research and discovery units that are working with this Innovation Implementation Sciences Center to try to get some projects off the ground and actually implemented. We're just at the very, very beginning of it, but it's very exciting. And if you're in an institution where you're trying to figure out how do we make this happen, that kind of a structure is one thing that you could explore.
A couple, quick points. One was, I guess, kind of a cross-cutting theme that really seemed to be emphasized by most of us on the panel had to do with, a real emphasis on that children and families and then the folks that they work with, either in services like teachers or clinicians, that those are all then connected to organizations and systems, and paying attention to that kind of infrastructure is critical as we think about implementing whether it's more narrowly defined or broader, more complex kinds of change strategies. And the other one I forgot, so I'll mention in a minute.
Well, thinking about common elements, one of the common themes that I heard did have to do with, you might think of it as customer orientation or consumer orientation, that none of this stuff succeeds ultimately unless you've got, whether it's buy-in or input or stakeholders who really believe in what you're doing, and that's got to be part of your process, and we can't just hope that it happens or consider it after the fact. You want to really do this in a systematic way and plan it from the outset.
My thought, I want to come back to the question about funding, and I'm struck by the fact that we have entire federal agencies. I want you to think about NSF and the Department of Education that have units focused on research to practice, and yet what they call research to practice is still on the left side of the slide. I think it's great that this slide is still up there. Part of what I think this forum is about, and what I think Renée and her staff are doing, is really about redefining what we mean by implementation science and redefining the content that is necessary to go from identifying effective practices to getting those practices in place. What you've done is you've given us the right side of the slide, and in part, we have federal agencies who have the task but are doing the wrong steps. If we were to actually say, what is the science of implementation and what is the process of implementation, that would actually be exactly what they're set up to do. We, quite frankly, have not given them sufficient clarity about how they could accomplish what they want to do well. I think they're there. They need to come to your talk.
So I have a couple of questions, and people should certainly queue up at the microphones for additional questions. You know, there are lots of programs that have high appeal, and even though they may not have evidence, they are used and implemented. There are diet programs, there was whole language, sensory integration. There are lots of things that we might question. Why do they have so much staying power? And what can we learn from those programs? Does that inform implementation science at all?
Well, I think it absolutely does. And who among us hasn't been frustrated at watching something succeed that is, completely baseless? And, so, but I think you have to ask yourself why. And I think the answer to that often is that whether the product has value or not, they have figured out what people care about. They've figured out what people care about, and the other difference is they have the resources to play upon that in marketing. And so rather than be frustrated by that, we have to figure out a way to implement some of that in our own work and figure out what people are looking for and figure out a way to get it in front of them more often and make it appealing on their terms.
That's a great question, and it makes me think of the DARE program. I mean, we all know that the research show that it doesn't work. But what I think what we need to ask is, what is driving folks? What is that yearning? What is that need? What is that hunger that they're embracing it because they believe it works? I mean, part of it's that the average person probably doesn't know what the evaluation's showing, but it's tapping into that hunger and that need and the image around it.
I think part of the problem comes back to your slide number 7 or whatever it was that said, how do people select? And evidence-based was at the bottom. One of the reasons why we get exactly what you talked about is people promise the stars without actually delivering the data that support it. I want you to think, if any of you are from states that got race to the top funding, right? You got race to the top funding to increase early literacy. One of the things that state superintendents of instruction got is within about 2 days, less than 48 hours, they started being bombarded by companies that say, I have a reading program that will increase the proportion of kids who meet state standards by 200% within 15 weeks at only $14 million if you buy my stuff, right? And the promise was very, very high. What we don't have, one, I think you pointed out a problem, not just a function. We have not taught. First ask, does it work? Then ask, do I really want it, and is it efficient, and is it effective, right? I mean, you've got to start there. How many states actually have formal systems where they help school districts on how to select effective communication, reading, math programs? If we are actually going to deliver what we're supposed to do, we've got to get down to delivering that level of marketing so that we've got people choosing based on more functional criteria.
I would just add that the we doesn't have to be people in the room as researchers per se. It could be like a foundation, for example.
Well, I was just going to add too that some of the aspects of fit and exploring need and looking for kind of those overlaps and those points of connections are very much part of a lot of the implementation practice that we've been talking about in terms of taking the time, whether it's pre-implementation, to really be looking for some of those connections and making decisions. The other thing I wanted to point out is on the kind of formula for success, the what times how equals socially significant outcomes. That socially significant outcomes, that framing is deliberate. So this isn't just any outcome. This isn't just a 0.02 or whatever statistically significant. I used to, in public health, get so frustrated with some stages of change that used to say, but they moved 0.05 in a direction from pre-contemplation to contemplation, and that gets your paper published. Well, who cares? Did it change anybody's action? Did anybody benefit from that kind of change? So I think tomorrow there's actually a talk that's looking at social validity and some of those aspects into how we're actually measuring and determining what is meaningful for the lives of the children and families and individuals that we work with. So that's one critically important aspect there. I think the other that related to, what implementation science can really add is giving people some of the language and the perspective and really the space and the permission to ask those kinds of questions, which is not just, did it work, but show me how it worked, whether it's then they're asking for a local demonstration or something that looks more like them. But through some of the frameworks, like getting better at saying, is there a there? Show me what's behind the curtain. When we're talking about these usable interventions, it's really giving people the tools, the phrasing, the opportunities to say, so show me how this is teachable, learnable, accessible, so that if it is working, we can repeat it over and over, not just for this group, not just for this month, but looking at that long kind of decade approach. So it's giving people some of that space and opportunities to do just that.
Great.
Hi, thanks. I'm thinking around the same
You need to
theme
introduce
here.
yourself again.
Yes, Katrina Steele from Toronto. So if we look at the user review panel idea that you've put up here on the slide, I think this is really critical, and I'm wondering if there are actually different user review panels that need to be at different stages of the system. And the scenario that I'm remembering is a project that we tried a couple of years ago where we tried appreciative inquiry methodology, where you go to the group and they sort of come up with the ideas that you're going to pursue. And our struggle was that the ideas they were coming up with didn't jive with our expert knowledge of evidence. In fact, we felt they were, there was a real risk if we allowed the group to steer us that they would pursue entirely a wrong intervention or a wrong direction. So I'm wondering where you see the science, the experts coming in to guide the questions that are asked and guide that group thinking process.
Great question, and kind of a complex question. I'll try to answer at least two of the parts of it. So one of them is if you have, your expert review panel has things in mind that aren't even on the short list. They're not even on the menu. So I think you have to enter that process with all parties understanding what you're trying to accomplish. And the answer for, we want something that you haven't built or that hasn't been proven effective isn't, sorry, that's not an option. That's actually the feedback loop that you get there. That's exactly why you have that loop there, so that can go back to people saying, look, what they don't want A, B, or C. They want D and E, and can we either find a way to make D and E work better than they have, or create something that could do D and E? And so that's the value of their contribution there. I think the other, the first part of your question, which I think was around, in some ways, the composition of user review panels, is a really interesting one. So I think you could divide this a number of ways. So for example, let's take schools, for example. One of the things you could say, we need a user review panel representing schools. And what we're going to run by them is the universe of things that would apply to schools. So not just speech, language, and hearing, but tobacco prevention and control, and alcohol abuse and safe whatever. So you could do it that way. Another way you could think about it is, we're interested in speech, language, and hearing. There are going to be stakeholders across the spectrum, from those in clinical settings to community settings to school settings. So you're going to organize them that way. I don't know that there's a right way to do that, and I haven't thought about it enough to have a preference. But it's an important question that you'd have to answer before you did something like this. Thank you.
Kirsten, did you want to respond to that too in terms of?
I thought it was interesting because it's similar to what that other gal asked me. Yeah. And I'm thinking back on some projects, and I had mentioned, I don't remember how I worded it, but basically open, honest dialogue. And we have found that when we're sitting around a table with community members, we can be very honest and say, you know what, here's how we get paid. We get paid by applying for grants and bringing in money. Now, we want to combine that with what makes your lives better, but we have found that the more you put it out on the table and you just honestly say, here's who we have to answer to, folks get that. They know that you have a boss. They don't understand how it works till you explain it, but that's one thing that I'm thinking of is open, honest dialogue. But then I also wanted to give an example. When we were working, and I realized folks are not doing family violence as much, but that's the example applies nicely here. When we were defining domestic violence for our first assessment project, the community partners around the table said, okay, we have to expand this. It's not just intimate partner violence. So it's not just spousal abuse, boyfriend, girlfriend abuse, etc. And I said, well, what do you mean? And they said, well, in the Chinese community, the violence comes through the mother-in-law. It is intimate partner violence, but it comes through the mother-in-law. And I said, nope. We have got to have some limits. We can't just open this wide open. We got to define things and stick to it, or it can't be science. And around the table, they said, no, you are wrong. And I said, oh. And they said, if you want to partner and you want this to be a give and take, and you want to be culturally competent, for God's sake, anthropologist, then you need to hear us. And they were right. And so the reason I bring that up as an example is that is a way that I had to be open to changing the question of the definition. So.
One real quick response. We do a lot of work with talking with teachers about how they want to change the social culture of the school, and working with families around changing the social culture. And the only quick thought I had would be coming back to the model that Dennis gave us. If we start by saying, what programs do you think we should use? We get exactly what you were asking. If we start by saying, what are the features of an environment that would really be productive? So if we ask first, how would we know? And part of it is you come up with things that are smaller, that are cleaner, and you actually include, we want to do things that actually work. I mean, they won't say, I really want to adopt evidence-based practices with high efficiency criteria. But they will say, we want things that real people can do that actually are effective for the kids. And so the one little tiny comment I would have is start with the conversation about how would we know if we came up with something before you go straight to the what are the programs.
And I think I was just going to add, I think an overarching theme here has to do with, it kind of builds on your comment about transparency and the kind of courageous conversations that are involved in some of this. We want to start and lean in with managing expectations, whether it's being transparent about some constraints that are part of the role that you have, but also I think in going back to kind of this formula for success as well, kind of starting with, why are we here? Are we frustrated that we're doing the same thing over and over and expecting change? Are we frustrated that We're not putting into place effective practices so that behaviors actually do change. And if you can kind of come around the idea of we want these outcomes to change, if you're starting with that aspect, then it creates kind of a mechanism, it creates a foundation, kind of a coming back to point in the conversation, so that as people are raising their own innovative ideas, or maybe going back to programs that feel comfortable but aren't quite getting you there, you can kind of gently come back. We talk about this kind of like as gentle pressure relentlessly applied. That's what a lot of this work is really about. And you can go back to, well, you know, what really brought us here was that we want these behaviors to change. We worked in this a lot with substance abuse prevention with teen drinking. And a lot of people have a real comfort zone around like social norm campaigns, you know, let's do the billboards, stuff that, you know, you can see, maybe that makes you feel good. And the whole point wasn't necessarily to shoot that down and say, well, there's really no evidence, although there is a way to kind of communicate that as well. So it's kind of meeting people where they're at, taking us back to, well, why are we here? And then maybe it's teaching in both directions. It's community helping us understand relevance and a reality check, and it's us kind of leaning in as well to say, you know, we know a lot about these strong levers of change, and we're not saying that the norms don't matter, but if you really want to change behaviors, it has to be coupled with something that's going to change youth access to alcohol. If we don't change access, whether that's social or commercial, we can do all the norming we want to, and behaviors won't change. Will the community feel good about us doing something? Absolutely. And not to dismiss that. That might be a great place to start to get people rallied around, but we have a responsibility as well to be having those courageous conversations and kind of meet in the middle. So it's not that something is shiny and feels good, it's shiny and feels good, it's feasible, people like it, and we're actually getting to outcomes.
Great. Nothing.
One thing we're doing is at Indiana also is we're trying to build capacity to do this work where we don't have a lot of capacity now. So we're creating training programs for people to learn how to become experts in implementation science. We're building a master program. We think that'll lead to a PhD program. You know, you may think about recruiting people to do this work at your place if you don't feel like you have the skills. You know, when Dr. Kreuter here was talking, I was looking at his bio to see if we could recruit him, but he's a dean and it might be hard.
Hi, I'm Natalie Douglas from Central Michigan University, and I was wondering if you could talk more about the relationship between scaling up and the power of that very local context. There seems to be a back and forth between we want to scale things bigger, but the power of the local context is something that is so strong. I study how to implement best practices in skilled nursing facilities. One of the things that I run into quite a bit in assessing organizational cultures is there'll be one nursing facility with no resources, no staffing, no budget, no nothing, and then it's so variable that the other one is fully equipped with staff, and then it's hard for me to conceptualize where to begin when the local contexts are so different.
There's a concept in business called co-creation, and while you don't know the name perhaps, you almost certainly know the phenomena. So if any of you, or perhaps your children, have ever gone on the Nike ID site to make your own Nike shoes, this is the concept. So you start with a shoe, but you make all sorts of choices. You can choose the color, you can choose the fabric, you can choose the, is it laces or a strap, and all sorts of things to design it. You're allowed change and customization within a set of parameters. You can do this with all sorts of consumer products and services. The notion that we can't do the same thing with evidence-based programs, I think, is silly. We can. We have to figure out, what are the active ingredients that really have to be there in some form, but there are other parts and pieces and context and application that is indeed flexible. Sometimes I think we're so rigid that we somehow have fooled ourselves into believing that it's one way, it's exactly the way we did it, or it has no value. And I think that's wrong. We're not very polished at this co-creation thing with our solutions, but it's absolutely doable.
A quick thought in terms of Michigan. in terms of implementing PBIS within Michigan, we started off with the major large school districts in Michigan. But part of what we learned is taking the active ingredients, we had to implement those differently in the Upper Peninsula. We had to implement it differently in Grand Rapids. And we're still learning how to implement it in Detroit. So I think part of it is by focusing on the core, on the kernels, on the core features, the active ingredients, you can get to those same things differently. In Michigan, you use ISDs as your way to access major school systems. You will never get scaling up to work unless you build the training, coaching, evaluation, and expertise at the ISD level. So that's in part adapting the big ideas to fit the local context.
A couple of quick points. I think this idea of co-production relates well also to this idea of co-creation. And I just wanted to point out that one of our colleagues at NIRN, Allison Metz, just published a nice resource anchor now for the rest of us about this idea of co-production as it relates specifically to implementation. And this is an example actually in adolescent health with teen pregnancy prevention and a recent kind of overall review from the Office of Adolescent Health looking at those programs, and this is kind of a partner article looking at implementation and says, so what does it take? And co-production of a sense of implementation supports and implementation infrastructure between organizations as well as support and technical assistance arms like NIRN, as well as in some cases, whether it's a purveyor or a model developer of some kind of innovation. But a lot of that, I think we have a new anchor to be pointing to some of that in. The other point that I just wanted to mention were this idea of the core features apply not only to the intervention, but they apply to implementation as well. So right now with some of the work that I'm doing, we are in LA County, which is actually, we're in 3 offices in LA County, and one of the offices in LA County is bigger than most of the counties in California combined. And bigger than some kind of state infrastructure systems for some states as well. So to say that context is different in terms of this is caseloads for child welfare, that resources are spread, and in some cases non-existent, we've still taken the idea of these core features and kernels of implementation, especially coaching and especially linking with leadership and organization to think about, so, how do we do this? Right now, they might have some grant funds to support some outside resources to come in, but thank goodness, pretty fast, these organizations also thought, we can't sustain this. So we have to press pause, use the resources and learn from the resources, the coaching resources that we're bringing from the outside, but immediately start to think about how do we build the capacity of supervisors who are here to stay as units in child welfare and build and lift up and support their role in coaching for no matter what the innovation or intervention or kernel or practice change might be, because they are going to be a keeper and a huge role in supporting that over time as context gets better and as context gets worse, because they're both going to happen.
I just wanted to riff on what you said about the choice issue. It's actually one of the kernels is equivalent choice. You never ask your 3-year-old, do you want to wear your red sweater? You always say, do you want to wear your red sweater or your gray t-shirt or sweatshirt or whatever it is, because the compliance rate goes up when you do that. So in the model that you were talking about in the Nike shoes, that's basically one model of shoe, but you can put all the decorations that you want on that thing. And if we design our interventions so that the sequence is flexible, how the training is done has different modalities. So for example, we've changed our training so that if you want to have subs, we can do that. If you don't have subs and you don't have a professional development day, we have another way of doing that. And all of those are tested. But if we adopt the Vladimir Putin version of dose and fidelity, we're going to have some rebellion. And I think that's what the sort of unconscious thing that has occurred is, no, we have to do it exactly the way we did it in the efficacy trial, and there is no other possible way. But at the design point that you're creating and developing things, always think about the choice points, always think about the flexibility points, and also think about, in every which way, every partner, every person in the system being a co-creator of the change. It isn't just the teacher that we're dealing with, it's also all of these other people, Rob, that you've very carefully identified have a great capacity, and spreading out those possibilities and thinking that through. It just takes time to do it, but that, I think, is important, is creating that inherent flexibility for adoption.
Tara McAllister, Beyond NYU. If I could bring us back to the question about what makes some interventions stick, or why are some methods, why do they get a lot of natural traction? I think it interfaces with a kind of broader question that is getting a lot of attention right now in scientific communication, because I think that if you look at the things that are, the ideas that are sticky, they tend to be simple. They tend to have that sort of sense of cognitive ease. They hang together well. And as we were discussing during the break, science is hard and scientific findings tend to be nuanced, and we as scientists, when we communicate our ideas, tend to engage in a little more hedging and hand-waving than you would hear from a marketer. So, and that might be why our ideas are losing out to the programs that are being sold with these very over-the-top claims, and also with just simpler stories. So I was wondering, I'd be interested in hearing your take on whether we as scientists, in order to market our ideas, should consider simplifying them to a level that we ordinarily might not feel natural doing, might not feel comfortable doing.
Well, I think one thing that I just want to say quickly about that, you know, I appreciate the reflections that you're making about kind of the complexity or the simplicity, you know, how feasible we might be conveying or translating some of this stuff to be. You know, I think a lot of that applies not only to the intervention or the practices you're talking about, but I'll be the broken record and keep taking it back to implementation. We have a responsibility in pitching, I'll say, and pitching the utility of this, of creating some small early wins so people can see that traction. If there's a huge latency between do all this and 6 months from now we'll see if it's in place, that's too long. And so we have a responsibility to be making those transparent and to helping to identify and lift up some of those small wins. And we also have a responsibility, I think, as we're thinking about the staging and the introduction of some of this implementation work, to not only to be thinking about one point that a lot of us have raised, which has to do with, you know, who do we need involved at this stage in this task to move things forward? Because one of the real key questions there is who benefits or who's bothered first. And their behavior might really be a door opening or a door closed, and how to keep that in mind as some of this work unfolds as well.
Yeah, that's right. Think about the value statement really seriously. I can give you an example from some work I've been doing recently in medication reconciliation, which is a way to manage medication safely in clinical settings. So I put in a grant proposal to study the usability of a technological product to improve this medication safety process. Reviewers wrote back, said, well, tell us more about how this is related to the active implementation of medication safety in the clinical environment. And it was a great question, and it was really about that value statement. So we went to our stakeholders, because we partner with clinical stakeholders in our institution, and we said, hey, we have a study that we want to do about the usability of this product. Does that sound like it would be worthwhile? And there was total silence, and nobody said anything. And we knew right then we had to really go backwards and start over and figure out what was going to be useful for them. What did they need?
Everyone can think of examples of inferior products that succeeded in large part because of marketing. And so I can understand why you might think, well, if we were just somehow framing our solutions better, there would be uptake. But I think the real story is that those are sort of exceptions to the rule. And the far more common occurrence is that inferior ideas never get off the ground, and they never succeed, or they fail not, they fail whether there's great marketing or not because there just isn't demand for them. And I think the reason that many of our research ideas don't get uptake is because as researchers, we tend to be focused on the things that we know, which are not necessarily the things that are going to matter to the users. So we focus on things like, theoretical constructs and comprehensiveness. And what users are really looking for is, can I do this in the 2 minutes that I have? Does this make me feel better as a practitioner? Or otherwise, does this make me feel awkward? Does asking this question, am I even comfortable doing this? And if you can't wear those shoes of, both the, whoever's going to be actually putting this into practice or the person who's going to be on the receiving end of it, and use that as a starting point, the odds that you can market your way out of that after the fact, I think, are very low.
Very good points. My experience is this. One of the reasons why inferior ideas get put in place is because they oversell. That's usually short term. When something really lasts, it's usually because it meets the needs of one group in the system, even if it doesn't produce the real outcomes for the other. We have many strategies in education that are really comfortable for staff, even though they're not productive for kids. And that's the reason why they continue to work. And we haven't done the fidelity measures to sort of sort that out. The second point, which I think is really a very good one on your part, which is how do we get the message out? Yes, we do need to simplify things, but I think it's not a good strategy to ask everybody in this room to be able to say the same things 5 different ways. Rather, have families talk to families, have superintendents talk to superintendents, have speech pathologists talk to speech pathologists. I mean, have the people who are of the community talk to each other, and it's going to be much, much more effective. That's partly why the collaborative approach is so much more effective, because you get the voice coming from somebody who is of your background.
We're going to have one more question.
Could I just say, as I was listening to both of you gentlemen, I just felt like I wanted to say, if the folks that you want to do the uptake were at the table from the beginning, you could be asking them, what's not working about this? So how early can you get folks at the table would be the question I would have for you.
Hi, I'm Lindy Morgan. I'm from Florida State University, and I've changed my question 7 times since standing here. I'm actually in the 4th year of running a large-scale effectiveness trial in the public schools, testing the CERTS model for children with autism, and I wish I could turn back time and redo this in a way that was more in alignment with implementation science. I've managed my grant funds in a way that I've been given an additional 10 months to spend some money and to work on dissemination efforts. So given the scope of the work, I've worked with 10 districts, 60 different schools, 300 kids. What would this panel recommend as some of the would be the key things to do in this last 10 months to really focus on dissemination? And I'll take my answer off the air so I can write down what you said.
Call Don Kincaid at University of South Florida. Link up with the University of South Florida system. The reason is you only have 10 months and you're very small. Link with the people who already have the formal networks and are going to be able to connect with both the users and the implementers, the people who benefit the children, the families, and with the people who are there. In Florida, you've got a giant state that is in some ways very well organized, other ways very not organized. Be careful of Dade County, but basically connect with people in University of South Florida because they are very, very good at dissemination.
I want to thank you for the perspectives that you've shared with us today, and you've humbled us with the knowledge that you shared, but also reminded us and inspired us about the relevance of the work that we do. You know, it's really important that we actually work to solve large societal problems, and then, you know, implementation becomes all the more important, and we can't start thinking about it soon enough in the development of our research programs. You shared wonderful perspectives, and we really applaud your participation.